Welcome, and thank you for viewing this, the second of two webinars on children's HCBS or home and community-based service waivers. This webinar will look specifically at the 4 HCBS children's waivers in Colorado. I'm Christy Blakely, currently the Executive Director of Family Voices Colorado. I'm also the parent of an adult daughter with disabilities. I've been involved in advocacy in Colorado for many years and have a passion to support families navigate Colorado's system of care for children with special health care needs. Also hosting this webinar is Advocacy Denver, the ARC for Denver County. This is how it often feels when you have a child with special health care needs. This webinar will hopefully provide you with information about children's home and community-based service waivers in Colorado and how to access them. It is our hope that you learn about the differences in the HCBS waivers in Colorado, how to become eligible for the 4 children's waivers, the criteria and services within each waiver, the steps to apply for each of the HCBS waivers and who to contact. Finally, we will help you understand the resources you have available in Colorado. Medicaid is publicly funded health coverage. It has federal, mandatory state plan benefits that are authorized by the Centers for Medicaid and Medicare, and optional services such as prescription drugs, therapies, HCBS waivers. This specifically were added to Colorado's services. The HCBS waivers are optional waivers. Next, let's take a look at the benefits pyramid for Medicaid, which you saw in the first webinar. When we look at these services as a pyramid, we can see that the state plan is the most widespread level of services and generally covers the most people. As you move higher in the pyramid, the services become increasingly optional and support smaller and more specific populations with the most intensive needs. Individuals receiving services at the higher level in the pyramid are also able to receive the benefits of the levels below. For instance, an individual receiving an HCBS waiver is also able to receive all of the state plan benefits, as long as they're not duplicative. One mandatory service that the state must offer is the Children's Program for Medicaid, or EPSDT. Early, E, periodic, P, screening, S, diagnostic, D, treatment, T. It makes sense. If we screen children early and periodically, we may find a problem. If we diagnose and use diagnostic measures to identify the problem and then treat it, it will save cost. The program federally also tells us to provide for children things that are medically necessary and from their birth until their 21st birthday. The child's benefit in Medicaid are richer than you can buy through a commercial health insurance plan. Home and community-based service waivers are not the only way for a child with special health care needs to access the Medicaid program. Colorado has several Medicaid buy-in programs. This one is specifically for children, allowing families to buy into Medicaid, just like you would a private insurance plan. Based on the Social Security definition of the disability, your child may be eligible for Medicaid if the family income is below 300% of the federal poverty level. It is best to speak with somebody about financial eligibility, as there are disregards and the limit changes annually. The highest monthly fee is $120. For example, if your child has private insurance and say 4 therapies a week with a copay of $20 each, you would surely be out of pocket more than $120 in a month, just in copays alone. Medicaid has no copays for children. Medicaid also doesn't allow balance billing for clients. Again, you have private insurance and you owe 20% of the balance bill when you have a hospital stay or purchase equipment. If you have Medicaid as a secondary insurance, you don't pay that balance bill or the 20%. Medicaid secondarily to private insurance can save money. They cannot bill you if they contract with Medicaid. When you have a child with special needs and are hoping to access a service or a benefit, be clear. The home and community-based service waivers were created for different populations. Discuss with somebody very familiar with all the different waivers which fits the needs of your child. Some questions you may hear: does your child have behavioral issues? Does your child sleep through the night? What services do you need besides Medicaid eligibility? These questions direct us to the best waiver to meet your child's needs. If your child has no behavioral issues and only medical issues, the Children's HCBS waiver may be the best waiver for your child. If your child does not sleep through the night and needs watching 24/7 or has significant behavioral issues, then the CES or Children's Extensive Support Waiver may be the best fit. Talk to somebody. For each waiver, there are 3 components of eligibility: financial. Until 18, we look at the income and resources of the household. The Human Services or Social Services Office in your county is the point of entry. Level of care. Case management agencies evaluate the child's level of care for eligibility. The tool currently used is called the ULTC 100.2, or Utilization for Long-Term Care. It evaluates the activities of daily living: dressing, feeding, bathing, toileting, transfers, and mobility. Targeting criteria. Again, case management agencies help identify if the child meets the targeting criteria eligibility. For example, does the child have medical needs for the Children's HCBS waiver or behavioral needs for the CES or CHIRP waivers? In order to access an HCBS waiver, the applicant, and this gets tricky, think child living as a single person, must have less than 300% of SSI's supplemental security income. This is calculated with all the assets the child gets. So we're looking at the child's assets, including child support, Social Security survivor benefits, assets in the bank, trusts, all income. The level of care eligibility is difficult to understand. The waivers are set up to reduce cost. For example, it's cheaper for the child to live at home than in a hospital. So eligibility is for hospital level of care, nursing care, or care for someone with an intellectual or developmental disability. Colorado doesn't have institutions or long-term care facilities for children. They were closed many years ago, but the level of care the child needs is the criteria for the eligibility. For example, the brain injury waiver is for people 16 years of age and older, so it's considered an adult waiver. You have to have a brain injury to be eligible for this waiver. Again, you may qualify for more than one waiver. Looking at the services is one way to identify the waiver matched the child's needs, but also through the level of care, financial, and targeting criteria for the waivers, you'll find eligibility. Home and community-based service waivers are an alternative to institutional care, providing institutional level of care to individuals who prefer to live in their home or community. Home and community-based service waivers allow states the flexibility to waive certain incomes and eligibility criteria, provide for specific services to targeted groups or geographic regions, have wait lists or enrollment caps, and provide individuals more choice and independence. If you are interested in an HCBS waiver, discuss this session. You would start the process by contacting your local CCB, case management agency, or single entry point. You would ask for an intake for the waiver or waivers you feel best meet your child's needs. The ULTC 100.2 is an evaluation to see what activities of daily living your child needs help with beyond what a typical child of the same age and stage might need. The ADLs, activities of daily living, are feeding, dressing, bathing, toileting, transfers, and mobility. There's paperwork and eligibility that once you get, there's paperwork. And when eligibility comes through the mail, if you are denied, there's an appeal process written on the back of the letter. Medicaid can be secondary insurance for your child. In fact, it's the best coverage you can get. In the first webinar, we talked about why Medicaid as a secondary coverage is cost savings. In fact, there's a program called HIBI, Health Insurance Buy-in, that actually pays for the percent of premium if your child has Medicaid, encouraging you to keep your private insurance. I'll talk more about this program later in the presentation. There are 24 single entry points that provide case management for specific waivers, including the brain injury waiver, children with life-limiting illness, and other adult waivers. There are 20 CCBs, which provide case management for CES, CHIRP, and the Adult with Disability Waiver and Supported Living Services Waiver, or SLS, for 18 and older. The single entry points, or the 4 private case management agencies, provide case management for the children's HCBS waiver. The 4 private case management agencies in Colorado, which only provide case management for the children's HCBS waiver, are listed on this slide. You can contact those if your child has a medical need and might be eligible for the children's HCBS waiver. Here are the links for the single entry point, the community center boards, and your county eligibility. There are 4 children's HCBS waivers in Colorado. The Children's HCBS Waiver, created to support children with medical needs 0 to 18. For this waiver, you would call the single entry point or case management agency for the intake. The Children's Extensive Support Waiver, or CES, for children with high behavioral needs and a line of sight care. The CCB, or Community Center Board, oversees this waiver. The CHIRP waiver, the Children's Habilitative Rehabilitation Program, for children at risk of out-of-home placement due to behavioral needs. And the Children with Life-Limiting Illness Waiver, for children who have an illness limiting a life past year 18. The Children's HCBS waivers were created to support children up to the age of 18 who are medically fragile in their home and community versus an institutional setting such as a hospital. This is the only children's waiver that only accepts family over the Medicaid income eligibility. In other words, if you are eligible for Medicaid by income, this waiver would provide nothing you don't already receive. Therefore, one step to accessing this waiver is a denial from Social Security stating your income is over the Medicaid eligibility limit. The only services the Children's HCBS waiver offers are case management and home health care program called IHSS, which stands for In-Home Support Services, a way to receive home health benefits within Colorado's long-term care, which is where the home and community-based services sit. The Children's Extensive Support Waiver, or CES, was created to support children with developmental disabilities and intensive behavioral needs and/or medical needs. The ages of eligibility are birth to the 18th birthday. The child must meet an intermediate care facility for individuals with intellectual disabilities, or ICF-IDD level of care. To begin the process for this waiver, you would contact your local community center board. At the end of this presentation, I have the counties assigned to each CCB. There's a large list of benefits for the CES waiver, as you can see on the slide. As we discussed earlier, no 2 children are alike. The best way to identify the needs is to discuss with the family what will best meet the child and family's needs. Not all services can be used due to limited amounts of these additional services above and beyond Medicaid. These services are fully defined in the link on the previous slide. I recommend having a discussion with the family without the list, asking what would assist the family the most. Letting everyone share thoughts often brings the services most needed to light. The Children's Habilitation Residential Program, or CHIRP. The CHIRP waiver has had the most changes recently of all the children's waivers in Colorado. This waiver has been developed to provide services for children and youth with a developmental disability and very high needs that put them at risk of or in need of out-of-home placement. This waiver is from birth to age 20, and the child must meet the ICF-IDD level of care. You would begin this process by contacting your local community center board and asking for this specific waiver. As you may see, this waiver also has a very large list of services available. This isn't a menu. It is the supports needed to provide for some of our hardest to provide for kids in Colorado. As before, the services are well defined in the link on the Healthcare Policy and Financing website. Search for CHIRP. Hippotherapy does not involve hippos. It is actually equine or horseback therapy. I just thought I'd clarify that. The Children with Life-Limiting Illness Waiver, or CLLI, was developed for our kiddos with life-limiting diagnoses. Eligibility begins at birth but goes through age 18. These children must meet a hospital level of care. To begin the process for this waiver, you would contact your local single entry point or SEP agency. A slide later in the presentation has links for you. You can see from the list of this waiver geared to children undergoing treatment and who may not feel great every single day, and to improve the quality of life for a child that's life limited. I wish we could provide services such as this for all children, but that would break the bank. You may also note that providing therapy and counseling to families is very unique to Colorado. The website for healthcare policy and financing is very helpful. This link is the training provided for long-term services, which is where the HCBS waivers reside. There are both children and adult waiver charts showing side-by-side comparisons of the waivers, as well as a webinar and other materials. One item you might find helpful is a flow chart, which shows the differences of home and community-based waivers. So you would start the process by contacting either your CCB or your case management agency or single entry point. You would ask for an intake for the waiver or waivers you feel best meet your child's needs. The ULTC 100.2 is an evaluation to see what activities of daily living your child needs help with beyond what a typical child of the same age and stage might need. The ADLs, again, are feeding, dressing, bathing, toileting, transfers, and mobility. Of course, there's paperwork and then the eligibility. You'll get that through the mail. And if you are denied, there's an appeals process, which is written on the back of the letter. Be quick, the timeline is short. Having a child with special needs is difficult, and I always encourage families to keep records as it saves time and often provides needed information if there might be a denial. Keep track of medications in a simple Word document. Family Voices has a simple template on their website. Keeping a list of the procedures and hospitalizations throughout the child's journey will save you in trying to recreate later. I created a care notebook, a simple 3-ring notebook with areas of medical needs for my daughter. I just added evaluations and any documentation to the notebook throughout her life. Now I have a record which saves me much time. Keeping a mileage log in your car is another way to save time. Tracking mileage to doctors, therapists, and other medical appointments can really add up. The Medicaid rules can be found just like your private insurance policy book. It's called Volume 8, and it's a section of the revised statute for Colorado. Here are some links to help you along. HIBI, the health insurance buy-in, which I mentioned earlier in the program, helps pay back a percentage of the premium for your child's health insurance when you keep your private insurance but have Medicaid as a secondary. It is a program that makes sense, and I encourage you to find out more if you are on or plan to become eligible for Medicaid. You may not know it, but you have many resources in Colorado. The ARCs, such as Advocacy Denver, which is your ARC for Denver County and is hosting this webinar. But there are also ARCs throughout Colorado that will support you in many ways. They're funded by the ARC thrift stores. Check out your local ARC for training, advocacy, and perhaps education opportunities. Medicaid Managed Care Ombudsman. This is an advocate that can help with Medicaid managed care issues. Family Voices Colorado helps with health, insurance, navigation. It's a family-driven organization. As I've mentioned it several times in this presentation, we assist families to advocate for their children. We can help with insurance and problems with Medicaid or waivers, or just answer questions. Parent Center is our parent and training institute under the Education Act, or IDEA. They help with education rights and do training. HCP or Title V is at the health department in your local health department or the state. This program is funded through Maternal Child Health and provides case management or answers specific questions related to health. Parent to Parent offers a listserv and family support. Parent to Parent is a family-driven organization. They host a listserv which will help families connect with similar situations. And they're a wonderful resource in Colorado. The RAIs, or Regional Accountable Entities, we talked about earlier, and the Disability Law Colorado is our protection and advocacy group. As noted in the previous slide, we also have CCBs, or Community Center Boards. Here are the links for the single entry points for the Community Center Boards and the county eligibility. Most of these HCBS waivers end at 18. Why? At the age of 18, your child is reevaluated as an emancipated adult without your income and supports by Social Security. Are there adult HCBS waivers? There are adult HCBS, our home and community-based service waivers. We spoke about earlier healthcare policy and financing website and the children's waiver charts. There's also charts on that website for adult waivers. But stay tuned, as Advocacy Denver and Family Voices Colorado intend to create and record webinars for the adult waivers just like these two. We are in hopes this presentation answered your questions about the HCBS waivers in Colorado for children and what services are available in each waiver. If you have questions or need assistance, call Advocacy Denver if you're in Denver County, your local ARC, or check out Family Voices website or call us with questions. We're happy to help. Thanks for watching this presentation.